This is Whitney with Auesomely You magazine, and we have here the beautiful
E-Nasia.
Yes, and Miss E-Nasia here is a medical assistant. She is a lab director. She does DNA testing, specimen testing, you name it, she does it. So, could you tell me a little bit about more about what you do here?
Okay, so my name is E-Nasia again, and I do services as far as dealing with the lab or blood work, but also cosmetic things of, like, let's say if you have a little fat, I can do lipo, DNA testing. So I'm also a phlebotomist, and an instructor, a lab director. So services that we offer here can be. I'm a dot specimen instructor and collector. So let's say if you need DNA testing, you're curious to know what your blood type is, things of that sort. Let's say you might be feeling fatigued. Maybe we can do a blood work and then figure out in our wellness area of what remedies or vitamins you might need to help boost your immune system.
That's good.
Yes.
That's really good. They do a lot here.
Yes.
It's really a mock of the actual hospital, you know, because it's like a one-stop shop.
Yes.
But it's not as intimidating. It is so pretty in here.
Thank you.
Yeah, so I'm just like, what can't you get done here? So that's amazing.
Yes.
I'm so glad that you bring those assets to this
Thank
hospital
you.
because this is what we need.
Mm-hmm.
You know, especially in the world today where everybody want to know their blood work. Everybody
Yes.
want to know, you know, get DNA tests done.
Mm-hmm.
Just that's dated back in centuries ago that,
Mm-hmm.
you know, people would want to get their DNA test done. So I'm glad that someone that looked like us,
Yeah.
you know, where you can feel comfortable
Yes.
come into this environment where it's typically beauty services
Right.
when it looks like this and not, you know, so medically inclined.
Right,
You know?
and I think it's very important as us as Black women to have a face in the medical industry and beauty industry as well.
Yes.
And the reason why I feel like that's very important is because, you know, growing up, we only seen, but and you need to know, okay, who is someone that's like me, who has the same issues as me, you know, that I can relate to and feel comfortable with. And I felt like that's one of the reasons that drew me into the medical field. So, and I love it. I love it. And I feel like I'm making an impact because when I was in a hospital setting, it was surprising. It was surprising to see how a lot of the patients, like after like changing to be in the actual working field instead of the patient, and to see how a lot of people perceive how they're treated in the medical field, like as a patient when going to be seen and stuff. It's like it was disgusting to hear, and
Wow.
and not that they was being, but just their experiences. I just felt like, okay, maybe I can be an impact in a different way.
Yes, that's awesome.
Mm-hmm.
That's always good, you know, for us to not only note that a change needs to happen,
Mm-hmm.
but also be the change.
Mm-hmm.
You know, don't just talk about it, but just be about it.
Mm-hmm.
So that's amazing.
Mm-hmm.
I'm so glad, you know, you're needed.
Mm-hmm.
You know, you're definitely an asset to, I'm sure, this hospital. And we just want to thank you for coming.
Okay.
Let them know where we can follow you at.
You can follow me at The Real E-Nasia.
All right. Spell it out for me.
E-Nasia is spelled E-N-A-S-I-A.
Oh, thank you so much for allowing me to interview you. It was a pleasure.
Pleasure to meet you too.